Welcome to day one of our Things That Make You Go Poo series here on Femme Fusion Fitness. This topic is so important, and of course, so often we teach what we need to learn, and that is the case with me. I dealt with tummy issues my entire life, and constipation was a big problem for me. I know that constipation is not only a problem for many people, but really just lack of information and awareness about what's normal and what's not when it comes to going number two is really huge in our society. People don't really talk about it so much. It's certainly not something that we are sat down and, taught in schools. And sometimes it's not even really talked about or that open in families. And the thing is, everybody poops. And, everybody should be pooping every day. And so why don't we learn more about this? Why don't we talk more about it openly? If you are completely turned off right now, then please try to keep an open mind and learn something new today. If you are interested, then let's dive right in. I am going to begin by talking about, first of all, what's normal and what's not. And then we're going to talk about how to poop most successfully. In future episodes of this series, I'm going to share information about food, massage techniques, some movement techniques, yoga, but again, today we're starting with the basics. So first off, let's talk about what's normal and what's not. You may have seen the Bristol stool chart before. The Bristol stool chart is a chart that was designed to help people understand what is often seen in different people, but also what is ideal. So if you're looking at this chart, the middle picture, number 4, is considered to be ideal. It's kind of snake-like long, it is not hard, and it's not overly soft. So this isn't to say that if your stools do not look exactly like number 4, that you are unhealthy or something is wrong with you. However, this is just a guideline for you to kind of know, maybe if my stools are more like pellets, there's something that needs to be switched up. Maybe if my stools are more like soft serve ice cream, then there may be a problem there as well. Now, you really should be evacuating your bowels between 1 and 3 times a day. Anything less than that is considered constipation. A lot of people used to come to me when I was working in a clinical setting, and they would actually only use the restroom for bowel movements maybe once a week. And honestly, back when I was having my extreme stomach issues, digestive issues, I once went more than 20 days without having a bowel movement. Not that I wanted to go that long, but it was a real problem, and I was traveling and I was in so much pain. Now, if you think about the status of your guts when you let that long pass between bowel movements, you need to understand that you are having a buildup of toxins in your body, a buildup of waste products in your body. It's not only uncomfortable, but it's also unhealthy. Just like I always say, everyone is different, but sort of the ultimate goal and gold standard is between 1 and 3 times a day. Let's talk next about how to poop most efficiently and effectively. I'm going to take you into my bathroom and give you a few tips. All right, here we are in my bathroom, and let's talk about positioning, posture, and some tips and tricks to help make things flow nice and easily. So the first thing is you're going to want to use something to prop your feet up on. Now this is a squatty potty. It's especially designed to kind of snuggle in around the toilet, but you can use a step stool as well. You want the stool to be directly under your feet square on the stool. Maybe move it out a little more for me. And you want your knees to be slightly higher than your hips. Now when this happens, you don't want to let your back round like this. We still want to be lifted and tall. So again, knees are slightly higher than the hips, feet are square on the step stool or squatty potty. Now, you can just have your hands or your arms on your thighs. There's really no rules about this. Now, when you're sitting up, I want you to think about widening your sitting bones apart. This is just going to be a sensory thing. So think about widening your sitting bones apart and then play with the different positions. You can sit up nice and tall, and then you can kind of arch your back and then sit up nice and tall and arch your back just a couple of times. But you want to end up sitting tall. Now what you want to do is have room for your belly to actually expand. So this is not a time to be thinking about zipping up like we do during our isolated core strengthening exercise. This is actually kind of the opposite of zipping up. I mean, we don't want to be pressing and bearing down, but you want to be opening up and expanding so that you're helping to move things along easily. So what I like to think of is an expansion of the belly, and you can do this, so I hope you can see me, but you allow the belly to actually expand as you sit nice and tall. And what I like to do is to actually include a sound. So a sigh out, that's not a blow, not like a forceful, which sometimes I'll actually use to help zip up, to help actually activate and engage. It's more of a like a sigh. Now you can play with whatever works for you, but again, the sigh and kind of low and more guttural, if you want to make a sound with it, can be very helpful. But again, we're doing this with an expansion of the belly and thinking of an opening and a widening of the muscles that surround the anus. So the pelvic floor muscles, they surround the vagina and the anus and the urethra, so they can tighten up to keep everything in, or they can widen and open to let everything out. So right now we're thinking of widening and opening the area and also expanding the belly. So again, that expanding the belly. Now, you can experiment by shifting around, and that can be very, very helpful. So one thing you can do is actually spend some time leaning back. You might want to even try leaning back with your feet a little more forward. You can lean back. You can alternate leaning back with leaning forward, as long as you're not feeling like you're having to do a lot of work here, but you can lean forward and lean back. You can do a gentle abdominal massage while you're leaning back. So go up the right side of your abdomen, across to the left, and then down the left side, doing little circular motions. And I actually have a great tutorial for the abdominal massage technique, one technique that I like, in my Smooth Move System e-course. So I'll put the link to that in the video notes. But a very simple abdominal massage is just up, across, and down with little circular motions. Okay, so you can do that when you're in any position. You can also put your hands in fists, put them on either side of your belly button. So under your ribs, you don't want to be on your ribs, but under your ribs on either side of your belly button, and then lean forward and kind of wiggle back and forth. And then sit up and do everything easy and gentle. We're not doing anything that is super jerky or jolting. We want to be calm and easy. So those massage techniques can be very helpful. Again, shifting position can be helpful. You can even experiment with putting a leg up, maybe moving from side to side if that feels good to you. It really is all about what feels good in your body, what feels relaxing and opening for your body. And really the key is not to rush it. So we want to take our time. There's no need to hurry. All right, so now that you know how to position yourself, let's talk about some more factors. Of course, exercise and movement affects motility. So the more you are moving more throughout your day, every day, the less sitting you're doing, the better. Now, one of the reasons we get so bound up when we travel is that oftentimes we are seated for long periods of time in a car or in an airplane. All of that sitting just slows everything down. So moving more actually helps get things going in your digestive tract as well. Another thing is stress management. Now, you probably know that there's the sympathetic and parasympathetic nervous systems. The sympathetic nervous system is the more amped up, fired, turned on nervous system. It's when you're under stress, that's going to be more turned on. The parasympathetic nervous system is known as the rest and digest part of your nervous system. This is the one that's going to help just allow your GI system to do its work most effectively. So if you are spending your mornings rushing, if you wake up 5 minutes before you need to rush out the door for work, then you're not giving yourself ample time to be calm, be chill, relax, and let things come out as they should. So I highly recommend movement. Ultimately, right when you wake up in the morning, do some stretches, just move around a little bit. Water is a great way, warm water particularly, or lukewarm water, even just room temperature, but water helps move things along, and then doing something to just calm down and relax. Now, it's not to say that you have to have a bowel movement in the morning, but it is a good time because when you are sleeping overnight, your guts are able to do a lot of their work. Your natural detoxification systems in your body are doing their work. So again, the morning is really a natural time to just release, and ultimately it will happen after some gentle movement, some water, and some relaxation time. Now I'm going to leave it at this for today's episode. There are more episodes coming, more information coming about this really important topic, but I do want to share with you that if you are interested in a system for constipation relief, I do offer the Smooth Move System for Constipation Relief. It's a new e-course that has really great smoothie recipes and an abdominal massage technique that have helped many people and definitely helped me when I have occasional constipation. Also can help with gas and bloating. So please check that out in the video notes and stay tuned for our next installment of Things That Make You Go Poo coming up tomorrow. Until next time, remember, eat clean, move every day, and you will shine brighter. Thanks for watching.